if you're working with a patient, and again, it depends on the setting, diagnosis, all of that sort of thing. But if your patients, you would expect that your patient's heart rate and blood pressure would increase with activity. That would be a normal response. When you're doing exercise with any patient, if the heart rate goes down or stays stable, that's a sign that the heart is not tolerating the activity, right? It can't keep up with the needs of the body. The same with blood pressure. Your blood pressure should increase. From a systolic perspective, we typically see your systolic blood pressure go up with activity. With endurance-based activities, it'll rise initially and then level off, which makes sense because if you think of like a marathon runner, their systolic blood pressure is going to increase when they start running, but then it levels off. It's not going to just keep steadily increasing the whole time they're running. And your diastolic blood pressure should go up or down 10 millimeters mercury with activity. And so there are other, heart rate parameters depending on the level of activity, of course. And a great thing for clinicians to use if you're worried that maybe the patient's cardiac status is such that you really want to monitor that heart rate specifically, you can always use a formula like the Carbonin formula and figure out their target heart rate and where they should be exercising, and then monitoring their heart rate and keeping them in that range. And when they fall too high, either you're pushing them too much and need to back off a bit, or that there, could be something going on. But in general, if we're talking just basic screening, taking vital signs at rest, and then as a PT, when do I get concerned? I would be concerned with those patients who become symptomatic with activity that it doesn't correlate with.